Hi everyone and welcome to our webinar. I'm Claire, CEO of Kalix. I know some people are still joining, but there's a lot to cover, so we'll get started. We are thrilled to have you here today for this exciting webinar on Kalix's latest integration, Rupa Health. Now, Rupa Health is a platform for healthcare providers, including RDs, to order, track, and receive results from over 30 lab companies. Now, I think the Kalix and Rupa Health integration really supercharges the test lab management process. Tests can be ordered directly from the client's profile in Kalix, and the results are automatically saved to the client's file as well as their saved documents. Now, we have an expert panel here today to speak to you. Registered dietitian Marielle, Kalix's customer success specialist, will first speak a bit about Kalix. And then Matt, the marketing partnership manager at Rupa Health, will introduce the Rupa platform. And then Taylor, the onboarding manager at Rupa, will deep dive into the integration and the Rupa platform in general. So we'll get started. I'll first hand over to Marielle.
All right. Well, thank you so much, Claire, for that introduction. I am Marielle Morales. I am a registered dietitian. I am located in Orlando, in Florida, and I am usually the one that provides the trainings for Kalix, and I also help a little bit with tech support. I also utilize Kalix for my private practice, so I have a little bit of experience on both ends as a customer and also as an employee of the company. We're going to do a very quick overview of what Kalix has to offer for those of you that are not familiar with Kalix. We're basically an electronic medical record and practice management solution. We want you to grow your practice and not your paperwork. We know that we, as healthcare providers, don't love administrative tasks. We just want to spend time with our clients and patients, and having an electronic medical record that can do a lot of the administrative tasks for us is vital. And we were founded in 2012, and we've been empowering dietitians and now other healthcare providers to achieve a more efficient and profitable practice. Some of the things that Kalix helps build a better practice for you is that we're priced right. We believe that cost shouldn't be a barrier for you to grow your practice or your business so that you can get started as soon as possible and grow with it. It is powered by your feedback. And as a user myself, in my private practice, I love that every few months, Kalix releases updates based on what our users have been asking for, just so that it can help us manage our business better. So I love that we're not trying to imitate any other EMR, that we're actually just trying to help our customers utilize our software better and make it better for them. You will be able to get access to powerful and intuitive tools to automate those boring administrative tasks and grow your practice, so you'll have more time with your clients and less time sending paperwork and things manually, because there's a lot of things that you can automate. And you will be able to be HIPAA compliant, which is very important for us as healthcare providers, that we are able to protect the health information of our customers. So we utilize very stringent security protocols to maintain HIPAA compliance at all times. Some of the features and things that you can do with Kalix: you will be able to manage your clients, accessing client files from anywhere that you have if you utilize the online scheduling feature. We already mentioned HIPAA compliant communication between your clients and anybody outside of Kalix, but we also have a telehealth and webinar platform that allows you to speak to groups of people of up to 100, and you're actually in this platform today. Other features will be billing and payments. You'll be able to create invoices, submit invoices, create super bills, and provide your clients with them, and also submit insurance claims. So you basically do all of your billing side of Kalix without having to leave Kalix for anything like that. You'll be able to chart and document, and we have an extensive template library in English and in Spanish with chart notes and forms, client summaries, doctor's letters, and anything you can think of that you will need to start your practice as far as documentation, intake forms, things like that. We have already created those for you. All you need to do is customize them and make them work for your practice. You also have online forms and agreements. So if you do a lot of telehealth, or even anybody that has an in-person type of service, you will be able to send the forms that you want your patients or clients to fill out before the appointment electronically. And you can actually set them up so that they automatically go out via email or text to your clients. That way you get all of this paperwork that you need from them before the appointment. We also have secure messaging and fax, so you can share messages and communicate with your customers via email, fax, and text. They're all secured and encrypted and HIPAA compliant as well. Lastly, we'll mention briefly the pricing. We have two packages. $27 a month is the standard package, and $47 a month is the virtual practice package. One nice thing is that the integration with Rupa Health is included in both of the packages, so you'll be able to utilize Rupa Health services within any of those packages. You will be able to have unlimited amount of clients, unlimited amount of administrative staff, can have many practice locations, free unlimited support into Kalix for you for free. And we do a lot of updates every few months to keep everything up to date and working better. And you can also do secure and worry-free backups of all of your data as well. To give us a try, you can set up a trial account and try it for 30 days, see if it meets your needs. You can also set up training during those 30 days of free trial as well. We're happy to guide you and help you set everything up, and also to teach you how to utilize the platform so that you save time and get to launch as quickly as possible. You can set up training via kalixhealth.com/training. You can also send us any questions to support@kalixhealth.com, and feel free to navigate to kalixhealth.com so that you can set up your trial account today. So now I'm going to pass it over to Matt, who's going to give us a bit of an overview of what Rupa Health is.
Thank you so much, Marielle, for that run through. Hopefully everyone can see my screen. And I'm going to just really quickly run through at a high level, similar to both Claire and Marielle, pain points that we kind of are addressing. And then, this is kind of what I'm going to be reviewing very briefly, starting with the not so fun part of ordering lab work, right? This is something I think a lot of the folks in the audience can empathize with, around having to manage a myriad of different lab companies and tests, track those results, coordinating firms, drop shipments, the list goes on and on, which is really kind of going into a little bit of the why behind Rupa Health. We are the best way to order and manage lab work for practitioners. Our mission is to bring root cause medicine to the world. We do this. There's up to 15 hours a week per practitioner saved, and it takes you less than 2 minutes to order a test. And on top of all that, it's free. There's no cost to practitioners on one dashboard, which is why something like an integration with Kalix makes so much sense, because it really just continually saves you more time. In addition to flexible lab phlebotomy, multiple billing options, including HSA debit, a 3-month payment plan with 0 interest. And that, again, is all on top of the robust patient support team that we have that can help you every step of the process. Not to mention practitioner support. I'll just kind of let this here, hopefully you can see this, as far as the robust catalog that we have of lab companies and lab tests. And this covers a variety of different conditions. And so I'm just gonna, before I pass it over, I'm just gonna land on this page for a few seconds. Practitioners, those of you in the audience today, are really the reason we are here. We want to put you at the center of our ecosystem and build resources around you, which is really how we've been able to grow and develop this integration included. So with that, I'd like to pass the mic, metaphorical mic, over.
What it looks like on your side. So what I'm going to do now is I'm going to show you quickly the few steps that you have to take when you are setting up and integrating with Kalix, and also how you create an order directly from Kalix. We are used to seeing our integrations under the account settings button, which will be here, but the one for Rupa Health is actually under my details. If you click under my details, you will see up here, there's a tab for integrations, and now you also have Rupa Health on this section. All you do is, just like you would have done with this one, you will click connect and it will take you to the Rupa Health website so that you can create your account. Once you are set up and it is live, then the Rupa Health buttons will start showing up on your patient files. So let's take a look at one of our patients. So if you're going to see the Rupa Health button here, and you also can see it on the shortcuts buttons as here as well. So you can start your order from either one from here or from here. So I'm going to use this button for this case. Click on that, and then you will utilize the orange button to start creating your new order website, and then the ordering process will be very similar to what Taylor showed us. It's going to look like this. It's going to show the date, and it's going to tell you what test you ordered. If it's pending payment, it's going to show that. And once it's completed, it's also going to show complete under the orders from Rupa Health in that tab. You will also get an alert in your notifications here under the bell. Right below your task, you will see that there are lab results available. If we go back to our client, we can now see that the lab results are added under our documents. If you group it by category, you can see that they will show up under labs. So here are those, tells you a little bit about that test, and then you can open up that file and take a look at what the results were. And this is just an example of one of the tests that we ordered. So as you can see, it is a very simple process to create your orders and to take a look at the labs once they come back into your patient's file.
Hi everyone, this is Claire. I just want to interrupt real quick to show how to share the results with clients from Kalix. So as Marielle mentioned, when lab results come in, they are viewable against the Rupa Health tab in the client's file, but also on their client cover page, they're saved to the Uploads folder under Documents. So to share the lab results, I can click on the Share Documents button here, or Share Documents from the side panel. A pop-up will appear, and then I can select what I want to share. So my labs, I can also attach any other documents I want, and I click Share. Next, Kalix will generate an email message template. I can also choose to share the results with the client's contacts, such as their referring provider or primary care physician. I can choose which method to share it using, so I could select fax instead, and then I can click send. You can customize this message as much as you want. You can also modify the template used, so I'll just click send, and then that's it. I would now like to pass over to Taylor, who will give us a deep dive into Rupa's functionality.
Well, hi everyone. I am Taylor. I'm one of the onboarding managers here over at Rupa. So today I'm just going to walk you through a brief demonstration and walkthrough of our platform and how exactly you can place an order. So not only do we create a really quick and streamlined ordering process, but we also handle all of your patient support as well. So I'll also walk you through quickly the patient experience side, so you can kind of see what your patients will be getting from us once you place an order. So this is our Rupa website. Since you guys will have an integration with Kalix, you can order directly within the Rupa platform. Everything that I'm showing you today will still look the same. I'm going to head to our practice dashboard. And this is where you're able to manage. You'll be able to see, patient name, the ordering practitioner, and then the status as well. I just have a bunch of draft orders. Let me see if I can. Results are in. If a pending payment is pending, and if the test is in progress. And then once those results come in, you can change to results reviewed to kind of keep those separated. I'm going to hop right into starting an order. So that's new to your ordering screen. So over on the left-hand side is going to be any test that you can add to your cart. And then the right-hand side, I'll go through pricing and walk you through all the different ways to customize your order. So starting over here underneath your favorites are going to live any custom bundles that you've created. So if you have a bundle of tests that you typically order for, say, a new patient or a specific patient population, you'll be able to create as many bundles as you would like so that you can add that entire bundle of labs with just one click. So you can see I added this wellness standard labs bundle to my cart, and it added all of these biomarkers, saving me that much time from having to search from these individually. Once you do add a bundle to your cart, you are able to edit it for each patient as well. So, say for example, this patient recently just had their cortisol and HbA1c checked, so I'm going to remove those two. And then you can also add any additional tests from our full lab catalog. Right underneath your custom bundles will be any favorited test. These are individual favorited tests that maybe aren't part of a bundle, but you're ordering often, so that you can order with just one click and not have to search for it each time. And then right below that will be the full lab catalog. So you can search for any test in our catalog. Like Matt mentioned, we have over 30 specialty labs, and that equals over 3,000 tests in our catalog. So definitely a lot to choose from. We have some filters here up at the top that can help your search a little bit easier. And if you are wanting to favorite any test, you'll just search for that test, click the little heart that will turn it a pinkish red, meaning it's in your favorites, and that will bring it up underneath the favorites. If you ever want to remove anything from your favorites, you'll just click that heart again and it will drop it back down. All right, so for today, I just added the Dutch Complete to my cart just for demo purposes today, and heading over to the right-hand side on how we can customize this order. So starting at the very top is today's date. The order will automatically default to placing on the date that you're in your platform, placing that order. However, you can schedule that order out for a future date if necessary. So, say you just met with your patient, you're like, hey, let's recheck some of these in 6 weeks. It's already top of mind, so you can go ahead and put it in and schedule that for 6 weeks out. The order will not send until the date that is selected. This practitioner and the signing practitioner in your clinic, just making sure the correct patient practitioner is selected. And then going to head into a little bit on pricing. So for this Dutch Complete example, you'll see this $4.99 price that's crossed and grayed out. That is the retail price of the test. At Rupa, we do offer the lowest practitioner price that the lab offers and extend that to you and your patients. So that's that $300. So if you're ever looking through the full lab catalog, which is over here on the left-hand side, you may see the two price differences, and that's just the retail versus the lowest practitioner price. We are really transparent with our pricing, so you can break down this arrow and it will give you line by line what the patient would be charged for. So you can see the total test price, that retail price is $4.99. We do have a 7% Rupa service fee on each order total. This just covers everything that Rupa does on our end. So, all the patient support we provide, finding phlebotomists if a blood draw is required, handling any specimen issues or recollections, kind of all the back end work. Most all practitioners have their patients absorb this 7% fee, making the platform completely free for you as a practitioner to use. So we don't have any monthly minimum orders, no annual fees, anything like that. That brings that subtotal to $520. And with this test in particular, with that lowest practitioner price, there's a total savings of $199, bringing that total price to $321. So even with that 7%, still significantly less than that retail price. As far as payment options, we have two different options for you. We have patient pay and practitioner pay. Patient pay is definitely our most popular. About 80% of our practices utilize patient pay. Essentially, you would submit this order, send it to your patient, and then Rupa, when we reach out to your patient to collect the rest of their information, we will also collect for payment as well. So you're not having to manage, payment for any of the labs. With patient pay, we do accept credit and debit. We also accept HSA and FSA accounts, which some patients have and like to use. And then we also have a 3-month interest-free payment plan. So no pre-qualifications for that payment plan, and that order will go out after that first payment, so they don't have to wait the full 3 months to get that order started. Next option is practitioner pay. So that essentially, you would be paying for the test as soon as you hit send to patient, and then you would just charge your patient at your discretion through your clinic. If you do want to use practitioner pay, you'll just check this box that says, I will pay for my patient's order. You'll put in your card or bank account information that will save, so you don't have to input that each time. Next, just a couple ways to customize the order. First is going to be notes to patient. So they'll get the original collection instructions for the kits, but anything on top of that you need them to be aware of, add in here. We do have a ability to make snippets in your settings, so you can insert a piece of saved text if you're constantly typing the same thing over and over. Notes to Rupa, this is just anything you need a member from our team to check out before the order is fully processed. I don't see this used very often, but if anything comes to mind, you can type that in there. And then lastly is ICD-10 code. So at Rupa, currently we don't accept commercial insurance up front. We've just found it the smoothest process for patients to lock them in at that lowest cash pay price instead of getting a surprise max out-of-pocket bill that's way higher than that cash pay price would have been. So like I mentioned, with the patient pay, they can pay with HSA and FSA, which can help with insurance on the back end. Also, if you choose patient pay, we will automatically send your patient super bills so they can submit to insurance for possible reimbursement. So if you are using patient pay, I do highly recommend adding some ICD-10 codes so those can be added to that super bill. And lastly, the order will automatically default to sending via email. If you would like to email and text, you can add your patient's phone number in and it will send via a secure link. And then lastly, just send a patient. Bundles built out, tests favorited. It's really quick to place an order. All right, I just have a few minutes left. I just want to kind of show you what your patients will experience on their end. So once you place an order, the first thing they'll get from us is an email just saying, hey, your practitioner placed an order for you. If you chose patient pay, we'll remind them their payment options. We'll collect demographic information, their consent, and then collect for payment. If you choose practitioner pay, still going to give your patients the same support. We just won't be collecting for payment since you had already paid for the lab test yourself. I do want to note here that due to third-party billing laws and some regulations around specialty testing, we aren't able to ship test kits to patients in New York, New Jersey, and Rhode Island. It is something we're actively working on, so hopefully, at some point we'll have some resolution for that. But at this time, unfortunately, we aren't able to. Next, within 25, their test kit has shipped, and they'll get an expected date of arrival. 2 days after the test kit has shipped, they will get the bulk of the information for their test. We'll send them cheat sheets for each test that was ordered. Rupa has created our own cheat sheets that are pretty user-friendly to follow directions. There's some videos in some of them for collection. They'll also get the original collection instructions with that test kit once they receive that in the mail as well. We'll also send them step-by-step instructions on how to fill out their requisition forms. And then if a blood draw is required, we will recommend phlebotomist in their area based off their shipping zip code. So just want to touch a little bit more on phlebotomy. Like I mentioned, we'll proactively send your patients phlebotomist recommendations based off their zip code, so it's close to their area. If you do draw blood in your clinic or if you work with a phlebotomist closely in your area, you can add a preferred phlebotomist to your settings. So that will be the default phlebotomist that we would recommend to your patients. Rupa doesn't collect any fees around phlebotomy, so we will list they're aware and they would just pay the phlebotomist directly. This is just an over, what to fill out and what to leave blank. Once results are in, you will be notified via email. You can check your results from here or from the main practice dashboard. But luckily also with Kalix, they will automatically be uploaded to your EHR. And lastly is our patient support team. They are amazing and really there to help guide your patients through the entire testing process. They're able to answer any questions so that they can take some of that off of your plate and give you some time back into your day. So they can respond to any of the emails above, and a real member from our team will be in touch with them or reach out to us at support@rupahealth.com. All right. As soon as you do sign up, you'll be assigned an onboarding manager, either myself or one of my colleagues. We're just there to help answer any questions and help you get set up. So, if you do sign up, we hope you do, then we are available to answer any questions for you. But thank you so much. And I'm going to pass it back over to Marielle.
Thank you, Taylor, for that amazing explanation of what it looks like on your side. And now we are going to take some questions. It looks like we've been getting some questions on the chat. So I'm going to invite Matt and Taylor back so that they can maybe read some of these and help us answer some of those.
Awesome. Yeah. So I think we had most of the questions answered in regards to if you have a custom fee, you're able to set up, basically you're prompted to set up a Stripe account that then will link to whatever bank account that you want that those custom fees will automatically go into. We did get a couple questions on ordering rights as well as phlebotomy. And so Taylor, I think, was able to answer and walk through kind of the features we have around phlebotomy.
So there looks like there's a question about RDs using Rupa Health to generate income. I don't know if you want to answer that, Matt.
There are a few features, and Taylor went over, for example, custom fees is what we refer to them as. And those are the ability for practitioners, understanding every business is run slightly different. We want there to be customizability, which is why we offer features like bundles and even some really cool features like Lab Shop, which is a public facing almost front, allowing your patients to order tests through you. Do that would just be to be saving you time, understanding time is such a valuable currency, and what allows you to reach more patients.
That's great. All of that, and then also mostly just the custom fees. So, you can add like an interpretation fee. You can title it whatever you would like to. You can set that up in your settings. So some practitioners charge like an interpretation fee or administration fee. And then those custom fees are deposited back to you. So that's one way as well to generate some income.
And we also do offer a myriad of educational resources, both the majority of which is free to users and really anyone. And we have everything from best if you're just starting out, some good resources and tools to reach out to, all the way to a very specific test. Let's say you're looking to get more information on Lyme disease. There's articles, podcasts, both paid and free live classes and boot camps that all are centered around, again, the practitioner, your experience, and how we can best help you reach your in your practice's full potential.
Okay, so there's a few other questions do you have any info about how RDs are able to order labs using ICD codes with or without MD orders?
Awesome. I'll take that one. And that kind of it looks like it goes along with what Jessica was asking. Are there any labs RDs cannot order on Rupa due to being outside scope of practice? And are there doctors through Rupa who can order for RDs to get around this? Couple of really great questions. So as far as ordering access, we follow the lab's specific ordering access based on license type, credentials, and also the state that the practitioner is located in. Each state kind of has their own rules and regulations too. So there are RDs can order from a good amount of labs on our platform, with their own license. But for specific labs, I would encourage you to ask your onboarding manager, because they'll be able to pull a list specific to your state on which labs you're able to order through your own license. And then for the second part, are there doctors through Rupa who can order for RDs to get around this? Yes, we do have our physician services program, which you can apply for that in your settings tab once you sign up for an account. Matt also just dropped the link for our landing page so you can learn some more info and apply for that as well. So essentially, our physician services program does allow practitioners to order from labs that they wouldn't normally have ordering access to. And we do have signing MDs on staff that are licensed in all 50 states. So with physician services, it is on a per order basis. So as an RD, if there's labs you can order with your license, you can turn physician services off for that order. And then if you're wanting to order from a lab that you don't have ordering access to, you can turn physician services on for that order. And so, yes, we do have that feature that has helped a lot of practitioners order labs. And then just as far as ordering access, just double check with your onboarding manager, and we're more than happy to pull that list for you. I hope that answers your question, but let me know if you need any further explanation.
Awesome. Thank you so much, Taylor. And I really love the idea of the physician service. When I first heard about it, I was amazed by that you're able to offer that. I know as a dietitian myself, the issues that I have had when I practiced around being able to get the labs I needed for my patients. So it's really wonderful that we're able to utilize that now. And I did just want to add something about Kalix and the ICD-10 diagnosis codes. So Kalix will automatically input the ICD-10 codes that you have saved against the client's file into Rupa Health when you create an order. So that will save you a lot of time not having to input them yourself. So I just wanted to add that mention that functionality. Okay, so Dart from Kim, does Rupa work with any insurances for labs or only the payment option that you mentioned?
We lock patients in at that lowest cash pay price. In previous experiences, if a patient tried to run it through insurance and the insurance didn't cover it, they were getting a max out-of-pocket bill that was way higher than that cash pay price would have been. And unfortunately, a lot of insurance companies tend to not cover specialty testing. So we don't take commercial insurance up front, but we have those ways to kind of incorporate insurance on the back end that can help some patients. So again, with patient pay, they can pay with HSA and FSA account. And then also if you're ordering under your own credentials, using patient pay will also automatically send your patient super bills so they can submit to their insurance for possible reimbursement. But all of our pricing is discounted. It's the lowest practitioner price that labs offer. So still a pretty competitive pricing there.
Okay, so a few more questions. Is there a credit that we could get to try out the service ourselves? So that would be Rupa.
Good question, Carrie. We do have a few labs that offer first order discounts. So when you do sign up, we would be able to provide those labs for you that offer that. Other than that, there's no other credits. We extend that lowest practitioner price to you. So we do have a lot of practitioners that will place their first order with us on themselves or a family member just to kind of, get familiar with the platform. But then the only credits we have, I think 3 labs that have first order discounts when ordering through Rupa. And then I see one from Abby. Does the onboarding managers have any info on typical reimbursement for labs? Unfortunately, no. I wish I had some further information on this. It's really hit or miss. There's really no patterns to which tests will get covered with which ICD-10 codes or anything like that. It's really frustrating, and it's kind of all hit or miss. So unfortunately, I don't have any information on that.
And the only other thing I wanted to mention is we do offer some. They're not really discounts for labs, but some of our educational offerings, we offer boot camps that are 6 weeks with 6-hour-long live classes with subject matter experts. And it's usually tied to a specific lab test. And if you're able to order it on Rupa, the lab test is included as part of the fee. So if it's like a $400 course to take a 6-week course over the Dutch Complete with a subject matter expert like Dr. Carrie Jones, that test on yourself would be included in that price. And so just wanted to throw that out because I'm personally very excited about those offerings. So,
yeah, definitely. Mariel has entered a question, which was the $15 fee, Rupa having an MD to charge for lab, is it per practice or per time?
What it's trying to get at.
Yeah.
For our physician services program, when we have an MD that signs off on order, we do have an additional charge to use that service. It's not $15, it's $25 currently per test kit. So if you're ordering like a basic blood work panel, that's typically just one test kit. But if you were to order like a Dutch and a GI map, those are 2 different test kits for each one. I hope that clarifies that question.
Yeah, Jill says Rupa has saved me so much time and headaches. That's great. It's a fantastic addition to Kalix for sure. It's something we didn't really say a lot about it coming out, but it's been something that we have been working on for quite a long time. So was super exciting to finally have released it, etc. Does anyone have any final comments or anything they would like to add? No. Thank you everyone for attending, and thank you Taylor and Matt from Rupa Health, and thank you Mariel for your great presentation. Thank you so much, and have a great evening or rest of the day, depending on where you are in the country. Thank you. Bye. Bye.